Hi guys, thanks for coming back again. My apologies for having a bit of a delay on videos lately. I have had a little, well, let's say, a little visit to the hospital myself as a patient for a quick emergency op, but I'm okay, and I'm still at home. It's my first day back really, so still got stitches in place, and so I won't be able to go back to work for a few weeks yet. But in the meantime, I thought I'd do a little bit of an upload just to keep your taste buds going, as it were. Today, I want to have a quick chat to you about stethoscopes, really. When we have finished our course as an ECA, I don't know if it's normal for them to do this, but recently we've been given a pack of bits and pieces like a gel pack for your hands and things like that, and also we get a stethoscope. And the one we got issued, first of all, is what's called a Spirit. It's the make stethoscope. So it's got the bell and the flap each side. One is deeper than the other one. I won't go into what makes it work. Just want to show you the differences in the ones that are off at the moment. The thing with this one, it does work really well to start off with, but I found that I couldn't actually hear the more quieter of heartbeats and pulses, I think. So in the end, I had to go and get myself another steth. But certainly that is a really good one to start off with. And I know there's some other paramedics who actually kept on using this one, even after they changed from ECA to paramedics, they kept it on. So I've seen a couple of them using it. I use this as a backup, just in case my latest one is going to get broken. But you can pick these up quite reasonably, I suppose, on eBay or Amazon if you don't actually get them from training. With a steth, they have the soft tips, of course, to pop in your ears, and these are interchangeable. Depends on how big your ear size are. Again, depends on the packet you get. You might find that there's only one set of these. This is all it can take apart. You can clean it up, which is good. Whenever I do use it, I always clean with a wipe both parts of the barrel ends and the flat, because touching someone else's skin, you don't know when they wash, and it's not very pleasant to interchange it between patients. Okay, and you put it back in your pocket or you put it back in your bag, and then of course whatever was on there is in your bag. So one thing I did realise is that on the steths I've used, there's a way to click, okay, the bell over, and there's a little dot, okay, on the side. If you can see it or not. The dot will show you which side you are currently listening through. So if the dot ends up being, I can show you here. Can you see the dot there? If the dot ends up being on this side, that is the side that you need to use. When I first started using this, in the first couple of weeks, I had the dot that side and try to use it this way, and of course it doesn't work because the dot's on this side. Okay, so the dot is there to show you which part of the steth is going to be used. Okay, that makes sense. Okay, so the first one we used was a Spirit. I then changed because I was getting a bit frustrated. My hearing wasn't brilliant. It took me a long time to hear blood pressure through a stethoscope, and even now sometimes I get problems trying to hear the blood pressure. But after that, I got myself a Littman's. Okay, I know this is probably one of the most well-known names for steths, but there's a reason because they're very, very good. This one is actually a classic 2 SE, and what happens is it comes in a pack like this. So you get yourself your stethoscope, you have your little information sheet on there, And there was also a packet, is it underneath there? No, there was also a packet of spare ear sockets for them as well. Okay. The day I used this was a day I thought, my gosh, I'm never going to go back, because the Littmann's is that much superior of a stethoscope. It really does pinpoint the most difficult of heartbeats. Saying that though, I still have had some problems with it, but only because patients, I haven't even got the stethoscope properly underneath the cuff for the blood pressure, or I've had an ear infection or something. I just can't because I'm just deaf as a post. But that was the one I went for in the end. If you do end up ordering one of these, they can be quite expensive. Okay, so shop around. I got mine on, I think I got mine on Amazon in the end, but you can go straight to Littmann's website. But they range from, I suppose, £30 up to hundreds, I suppose. Even to the electronical ones, you don't need that. Like you've got pediatric, can't say the words, the children's one. You've got specific cardiac ones as well. So just be careful what one you get, because it's for specific things of the body, or it can be for certain age groups, or So look into it a lot before you buy, because it is quite an investment. But once you buy one, you realise that the basic stuff, the basic one you might get on, a first aid website, is not good enough for the job. And then just keep on practicing, because when you're using your steth in the blood pressure cuff, you've got to make sure you can really listen to it really, really well. They will teach you this anyway, but practice doesn't make perfect. Practice makes permanent. Remember that. Okay, so keep on practicing, and in the end, you'll get it. And in the end, when you're looking at the blood pressure cuff and the monitor, you can see the pulse on the dial, which will give you an indication as well. If you can't hear the pulse, you can actually see the dial going down. So you could just make sure you look at that as well. But that's another story. Okay, so yeah, I went for the Classic 2 SE stethoscope for Littmann's. I have got a spare Spirit one just in case I needed it. I keep the Littmann's sometimes in the box and sometimes in my pocket in my trousers. Depends how I wear it that day. What I do find is if I keep in my trousers, my seatbelt always catches a hold of it, and I end up losing the ear cuff. So because it's quite expensive, generally I would say try and keep it in a box if you can in your bag, and when you need it, then you can just take it out. But in practicality, it's a bit more difficult than that. Okay, so I hope that's helped a little bit on that side of things. If there is anything that we use on the ambulances that you've seen, you're not sure of, you have questions about, and if I know the answers to, I can get the answers for you, please do ask. It'd be really good to inquire and to find out for you anyway, because at the end of the day, every day's a learning day. Everyone is learning to something different, and it would be nice to sort of share and get feedback on this one. All right, well, stay safe. Keep out of hospital as a patient, please. Because the most embarrassing thing is about the ambulance service is that when you go to hospital, you see half your crewmates there, and that's really embarrassing. So I wouldn't recommend it. Anyway, take care, and I'll do another video for you shortly. Take care. Bye.